Welcome to Chapter 6, entitled The Role of Interprofessional Communication in Pharmaceutical Care. Pharmaceutical care can hardly be provided without collaboration with other healthcare providers. In its optimal form, interprofessional collaboration entails that providers discuss mutual goals, resources, and responsibility for patient care. In order to support this collaboration, interprofessional education is essential. Collaborating in healthcare is a competency and can be learned. One of the central elements in the competence, collaborator in healthcare, is interprofessional communication. This competency is characterized by different aspects, which apply whatever the medium used. We will begin by discussing from monodisciplinary approach via multidisciplinary care to interprofessional collaboration. In the most recent definition of pharmaceutical care, published by Pharmaceutical Care Network Europe, abbreviated as PCNE, pharmaceutical care is described as the contribution of the pharmacist to the care of individuals in order to optimize medicines use and improve health outcomes. Although the pharmacist, as an expert in medicines, can play an important role in a patient's medicines use, he usually does not do this on his own. Many healthcare professionals, abbreviated as HCPs, might be involved physicians, nurses, psychologists, etc. As already recommended in 1994 by the World Health Organization, the pharmacist should be a member of the healthcare team, and communication and effectively cooperating with the other members of the healthcare team is essential. In later documents, the WHO further reported that interprofessional collaboration also improves health outcomes. The current vision on ideal healthcare practice therefore not only includes patient-centeredness as a pivotal aspect, see Chapter 3, but also integrated service delivery. Next we will look at integrated services. The WHO has developed the following definition of integrated service delivery: the management and delivery of health services so that clients receive a continuum of preventive and curative services, according to their needs over time and across different levels of the health system. For the user, integrated service delivery means that the service delivery is coordinated, with a minimum number of stages in an appointment and a minimum number of separate visits. It also means that healthcare professionals are aware of the patient's health as a whole, and that different healthcare professionals across settings communicate as well as to make the care seamless and smooth. For professionals, integration happens when different healthcare professionals work together to provide services. In its optimal form, integration on the level of the professionals also entails that providers discuss mutual goals, resources, and responsibility for patient care. This is also referred to as interprofessional care or interprofessional collaboration. This is different from multidisciplinary care, where different aspects of a patient's care are handled independently by different professionals, without a common goal. In multidisciplinary care, each healthcare professional is responsible for his or her own area. This is not the case in interprofessional collaboration. Figure 6.1 illustrates the difference between both concepts. Other terms that are used in practice are interprofessional collaborative practice and interprofessional teamwork. When medicines are part of a prevention or treatment plan, a pharmacist is essential to ensure the responsible use of medicines, and by doing so, to contribute to the best quality of patient care. According to the International Pharmaceutical Federation, abbreviated as FIP, collaborative practice should therefore be seen as critical to developing pharmaceutical roles in healthcare systems. Looking at the role of the community pharmacist, it is clear that there is a trend to multidisciplinary collaboration, but that interprofessional collaboration is less frequent. The most progressive countries are Australia, Canada, and the US. For the latter two countries, national initiatives promoting collaborative practice and describing the role of the pharmacist have been launched. Australia integrated in 2010 a statement on interprofessional collaboration in the National Competency Standards Framework for Pharmacists. In Europe, the Netherlands was the first country to establish working groups between pharmacists and physicians, FTO, local pharmacotherapy concentration, and FTTO, transmural pharmacotherapy concentration, in order to improve collaboration and optimize rational prescribing. True examples of interprofessional collaboration are often part of a trial and discharge or examples of interprofessional collaboration that have recently been worked out and investigated in studies. Both examples are illustrated in the box, as shown in Figure 6.2. In contrast, a review of Medication Review, MR, Services in Europe, 2014, showed that only in a limited number of implemented services case conferences with the physician were fully integrated, 3 out of 11 of intermediate medication review services, 4 out of 6 advanced medication review services. The Dutch, FTO, pharmacotherapeutic consultations between GPs and community pharmacists, focuses on optimal prescribing since approximately 1990. Pause the video and carefully scrutinize Figure 6.1 illustrating the difference between multidisciplinary and interprofessional collaboration, based on Sarkadzidis and colleagues before advancing to the next slide. Pause the video and carefully scrutinize Figure 6.2 illustrating examples of interprofessional collaboration before advancing to the next slide. We will now discuss the prerequisites for multidisciplinary and interprofessional collaboration. The first challenge for interprofessional collaboration is to have the appropriate range of skills available in the healthcare team. The second challenge is to ensure that the different healthcare professionals effectively work together. One of the ways to achieve this goal, and that has been recognized by WHO and FIP, is to set up interprofessional training or interprofessional education, abbreviated as IPE. This refers to occasions when members or students of 2 or more professions learn with, from and about each other to improve collaboration and the quality of care and services. Learning with each other refers to the fact that the content of the training that is offered, e.g., on geriatric pharmacotherapy, is the same for all healthcare professionals, e.g. nurses, GPs, pharmacists, etc. Learning from each other means that one healthcare professional can learn from another healthcare professional, e.g., a GP can learn from a pharmacist about drug-drug interactions. Learning about each other refers to the fact that while following the same, interactive, training, you get familiar with the knowledge, skills, and attitudes of healthcare professional from a different discipline. In general, interprofessional education results in better knowledge and recognition of each other's expertise, better and more effective communication between individuals and professional groups, better sharing of workload and responsibilities, less tendency to strong specialization and profiling, less rivalry, improved job satisfaction, and higher quality of care. There have been a few examples of interprofessional education involving pharmacy students. Based on qualitative data, Gilligan and colleagues indicated that although interprofessional education is universally claimed as a good idea, there is still much room for improvement. We will now look at interprofessional communication, a central element in collaboration. It is important to know that collaborating in healthcare is considered a competency, and hence that you can learn to collaborate. It also means that collaborating is not something that can just be imposed on people, without knowing how to collaborate or what is important in collaboration. Based on the CAN-MEDS roles, Sarkadzidis et al. Have described 7 roles that characterize the competence collaborator in healthcare. These 7 roles are visualized in Fig. 6.3. Similarly, core competencies in interprofessional collaboration have been described by the Canadian Interprofessional Health Collaborative, abbreviated as CIHC, and the Interprofessional Education Collaborative in the US. In all these models, interprofessional communication is considered as a central domain. Pause the video and carefully scrutinize Figure 6.3 illustrating the roles of collaborator in healthcare, based on Sarkadzidis and colleagues before advancing to the next slide. Next we will focus on interprofessional communication for pharmacists. The Interprofessional Education Collaborative Expert Panel has listed 8 specific interprofessional communication competencies. Rather than just discussing each of these competencies, we will use the following examples to illustrate how these competencies might be needed and can be reflected in pharmacy practice. As pharmacists mostly collaborate with GPs and nurses, examples will be limited to that context. Choose effective communication tools and techniques, including information systems and communication technologies, to facilitate discussions and interactions that enhance team function. As to achieve integrated service delivery, the pharmacist involved in a long-term care facility supports the development of a shared electronic health record, and takes responsibility for drafting and updating the resident's medication plan, integrated in the electronic health record. Organize and communicate information with patients, families, and healthcare team members in a form that is understandable, avoiding discipline-specific terminology when possible. When trying to explain the reasons for a change in the drug regimen of a patient to the nurse, the pharmacist focuses on the effects that can arise from the combination of the 2 drugs and the symptoms that may be experienced, rather than on the CYP mechanism. Express one's knowledge and opinions to team members involved in patient care with confidence, clarity, and respect, working to ensure common understanding of information and treatment and care decisions. When contacting a GP about the dosage of an antibiotic for a 3-year-old child, the pharmacist respectfully asks the GP about the dose calculation, without giving the impression of a lack of knowledge on the part of the GP. Listen actively, and encourage ideas and opinions of other team members. In a discussion on the medication regimen of a nursing home resident, the pharmacist carefully listens to the nurse, in order to understand the effects of the drug on the resident, and the fact that the resident is not able to participate in social activities due to the side effects. The pharmacist asks the opinion of the nurse on the proposal to try to reduce the dose of the drug, rather than stopping the drug. Give timely, sensitive, instructive feedback to others about their performance on the team, responding respectfully as a team member to feedback from others. Having sent several unanswered emails to a GP in order to make an appointment to discuss the findings of a medication review for a particular patient, the pharmacist calls the GP, informs about the emails and the reason why they remained unanswered, and shows in a sensitive way his disappointment on the collaboration so far, as the patient had to wait for an answer on different drug-related problems. The GP apologies for the delay, and asks the pharmacist to clearly mention the subject in future emails, as well as the due date, so that he is more aware of the urgency. Use respectful language appropriate for a given difficult situation, crucial conversation, or interprofessional conflict. Being informed about an error in the administration of a drug by a nurse, who previously made the same mistake, the pharmacist respectfully questions the nurse on the causes that may have led to this mistake as to avoid similar errors in the future. Recognize how one's own uniqueness, including experience level, expertise, culture, power, and hierarchy within the healthcare team, contributes to effective communication, conflict resolution, and positive interprofessional working relationships. A few months after the recruitment of a recently graduated pharmacist, who takes up more clinical roles, the chief pharmacist actively compliments her on her positive attitude and the way she facilitates the collaboration with the nearby nursing home. Communicate consistently the importance of teamwork in patient-centered and community-focused care. While explaining the interventions based on a medication review of a particular patient, the pharmacist refers to the importance of the preceding discussion with the GP, in order to adapt the medication regimen. And now we will look at interprofessional communication in current practice. While waiting for a full adoption of integrated services and interprofessional collaboration in daily practice, healthcare professionals communicate among each other and use different media to that extent. The examples in the box, as shown in Figure 6.4, specifically related to the role of the pharmacist, show the diversity of these media and how they can be used to obtain different goals. In most countries, developments in e-health encompass the development of a shared electronic patient health record, including a journal functionality that allows communication between healthcare professionals. However, there are still quite some barriers to exchanging health information, and it is not yet clear to what extent community pharmacists will get access to the information. Whatever medium chosen, all 8 aspects discussed before, and characterizing good interprofessional communication, apply. One additional aspect is respecting and guaranteeing the privacy of the patient. This is particularly true for new media such as web applications, chat boxes, etc. Hence, in most countries, the development of the e-health infrastructure also contains a thorough development of authentication and role identification procedures, as well as tools to prove a therapeutic relationship with a particular patient. Pause the video and carefully scrutinize Figure 6.4, illustrating examples of multidisciplinary collaboration and different media used before advancing to the next slide. Thank you.